Ooh, it's always fun to see everyone pop in. Hello, everyone. Welcome, welcome. If you are just joining us, you are here for the Career Path Spotlight featuring helping professions. We have some guests with us from our CAPS office as well as Student Health Services. So we will get started in just a moment. We're going to give time for everyone to log on and get settled. At this time, we're going to ask that we have everyone be muted as well as turn your video off. There will be time towards the latter half of the event for you to turn your video on to ask questions and engage with our panelists. But for now, for the first part, we have a couple questions that we're going to ask them, and we want to make sure that you can hear and see everyone well. So we're going to ask that everybody, again, just be muted and have your video off at this time. And I'm going to pull up our check-in screen. So give me one moment. All right. So you're going to see on the screen in front of you, there's a QR code. Students and alumni that are here in attendance, you're going to scan that QR code. If you have your phone handy, you can go ahead and just pull out your camera app and scan it. It'll take you directly to the web page where you're going to enter your FAU email address. If you do not have your phone handy, go ahead and use the link that's right next to it, which is bit.ly/spotlighthp, and that is going to take you to the same exact check-in page where you're going to enter in your FAU email address. So I'll give everyone a minute to go ahead and do that. Make sure you check in for the event today. And for those of you who are on a desktop or a laptop computer, you can go over up into the right-hand corner of Zoom and you can select to see the event in gallery view. So when I take the screen share off and that way you can see all of our panelists. And then anywhere on the screen, if you right click, you can actually hide non-video participants. That's going to clear up the screen so you can just see the panelists, and then that way you can enjoy what they have to say. And then at the end, like I said, we'll have everybody that wants to come on video to be able to ask questions and engage with them at that time. But for now, again, upper right-hand corner, click the gallery view, and then anywhere on your screen where there's a video, right click and click to hide the non-video participants for your best viewing. And I will put the check-in link in the chat. So for anyone that is coming in and still needs to check in, I want to make sure we can get started since we have a really awesome panel here this afternoon. So I will go ahead and put that link in the chat, and I will hand it over to my colleague, Dawn, who will get us started.
All right. So good afternoon, everybody. My name is Dawn Kesselman. I'm a career counselor at the FAU Career Center as well as Ella Feliciano. So we are both career counselors. We are liaisons to the College of Science and the College of Social Work and Criminal Justice. So we are always meeting with students who are interested in the helping professions, who want to learn, how can I get into counseling? How can I get into psychology? What does it take to become a psychiatrist? And so we thought, what better way to answer those questions than to bring in the experts that we have at FAU. So today we have a panel made up of great professionals who work in the Counseling and Psychological Services Office as well as Student Health Services Office at FAU. We have Marisol Blanco, Winifred Pierre, Greg Horn, Maria Gayarev, and Stacy Binns-Brown. So they will be introducing themselves in just a second and sharing with you kind of their pathways. How did they get into the helping profession? You can see they all have different letters and designations behind their names that they're going to speak to you about. So with that, let's go ahead and get started. So we'll start with Marisol, I believe. And so if you can all just kind of introduce yourselves, your degrees, your career titles, and just kind of a brief history or career pathway, how you ended up where you are today.
Okay, so hi everybody, my name is Marisol Blanco. I'm a licensed psychologist and I'm also a licensed mental health counselor. So the way that those two happen is that I started doing the master's in mental health counseling in Nova, Southeastern University. And then like a year after, I decided to also apply for the PsyD program, Doctorate in Psychology. And as I was finishing the master's program, then I started to join in the PsyD program. So when I was doing that, I did the internship in New Horizons, which is in Miami. I don't know if it's still open, but that was working with children who have special needs. And I did that for a whole year. And then as I was doing that, I was also working in a counseling center. And I was doing insurance billing. So that gave me an opportunity to also put my foot on the door and be able to take some classes in addition, so that I could be ready pretty much whenever I graduated. I could have a job in that place. And they were pretty good, and they provided me with supervision. They provided me with a lot of opportunities, and that's how I started my career.
Thank you. And Winnie?
Do you need anything more, or I wasn't sure if I needed to continue, or
I think that is
just leave it for later.
all right. I believe Winnie is next.
Hello, my name is Winnie. I'm a licensed clinical social worker. My undergraduate was from University of Florida in Communicative Sciences and Disorders. I transitioned to social work for graduate school because throughout my undergraduate, even though it's not directly related to social work, I engaged in a lot of community action organizations and worked with multicultural and diversity affairs. So I really enjoyed working and helping others in the community and just that social justice arena. So when I went to grad school, social work became on the forefront of my mind. Through my master's in social work, my first internship was working with Haitians, refugees coming from the earthquake. And that really first exposed me to trauma and the significance of mental health. And my second practicum was working in a psychiatric hospital for severe and persistent mental illness in the community. And I would say that would be definitely the start of my career foundation, because with social, there's so many different avenues, but through my experiences, I focused on mental health through social work.
Thank you. And Maria?
Hi, everyone. Thank you so much for being here with us tonight so we can share a little bit our experience, and hopefully we are not like very boring for you. Trying to make it like funny, interactive, and also useful. So I'm a doctor in clinical psychology, which is a PsyD program. The difference between PsyD and PhD program is that PsyD is a little bit more focused on clinical work, and PhD is more focused on scholarship and research, just a little bit. They're almost both 50-50. So I did my undergrad in psychology in Bulgaria, Eastern Europe. After that, I completed my master in clinical psychology in Europe, and then I came to the United States as an international student to study for my doctorate. Usually it takes about 5 to 7 years to complete a doctoral program in clinical psychology. It's like full time, so it requires all of your like time to do this. Each year you have different practicums, and you're encouraged to like seek many different experiences. So I did my assessment in a psychiatry hospital. After that, I was in an outpatient clinic working with children, adolescents, adults. My advanced practicum was with like people who are suffering from cancer and supporting them, their families, like grief groups. So it's a diversity of experiences that you can like provide for the community, the government, whatever you want to focus on. And after that, you have about a minimum of 2,000 hours of internship. This is like the last year, so you can get your degree. Depending on the state where you want to get license, you may have to do a postdoc, which is I'm doing my postdoctoral experience right now. In Florida, it's like the highest requirement. They require 2,000 more hours on top of everything. So you are getting out, like you are getting out of the program as an expert. So to become a licensed psychologist, it means that you have about 6,000 to 10,000 hours of experience before that. It's like doing surgery. You are not just going out and do surgery, like you are very prepared to be on your own. Yeah, so you can specialize with clinical psychology, you can specialize with like child and adolescent, forensic psychology, neuropsychology, health psychology, which is my perspective. Yeah, so many different opportunities, sexuality. Yeah, so that's it from me.
Thank you. Definitely an expert. And
Did you say you cut out there, Dawn? Did you say Greg? Okay, that's what I thought. Thank you. And thank you all for being here. I feel very grateful for, having the opportunity to be on this panel. And it's actually kind of fun to listen to my colleagues talk about what they do, because we don't sit around talking about this stuff. So it's a good opportunity. So yeah, I resonate a lot with what everybody has said. I'll try to add some things that hasn't been talked about already. I am finishing up my, I finished my doctorate in counseling psychology last August. So I'm finishing up my postdoctoral year, which is the year where you add the hours that Maria was talking about, moving towards licensure. So I'm doing that now, getting ready for licensure in a couple months. So fingers crossed. It actually feels kind of scary to not have any supervisors. I don't know how I feel about that. But yeah, it's I took a long, windy road to get where I am now. I started out working in a wilderness camp, therapeutic community, working with adolescents with a variety of behavioral issues, where I've lived in the woods for 2 years, basically. And that kind of got me interested in mental health and all of the things that come with that, and really the importance of building that relationship, because if you don't have a relationship with your clients, then they're not going to want to do anything that you want, that will help them. Because when I first started working there were many nights, late nights, where they were running all over the place, and I didn't have any control. And so learning that you have to show them that you care, show them that you are listening to them and want to be on their side and advocate for them. Once you do that, then you can do a lot. And so from there, I got a master's degree in clinical and health psychology, and then worked at an oncology, psychosocial oncology hospital at a cancer center for 3 years. working with doctors and cancer patients. So learning a lot about health and those systems, and how to provide counseling in those areas, how mental health is integrated into medical health. So that was really interesting. Then I worked in private practice for 4 years. So I spent about 4 years working with a master's degree, licensed in North Carolina. And then I decided moving more towards wanting to develop more in multicultural and social justice focus, going back to my doctorate degree in counseling psychology. So there's a bit of a difference between clinical psychology and counseling psychology, which I can talk about more later. Essentially, people do the same things once they're working, but there's a little bit of a difference in terms of like what the training looks like. And again, I'll be happy to talk more if y'all have any questions about that. But then I went to Memphis for my doctorate degree, and then that involves coursework, practicum at a variety of sites. I worked at a VA, I worked at a counseling center, I worked at a neuropsych place, and then an internship in Michigan, and then came down here for this job. So, yeah.
Thank you so much. It was really interesting to start in the wilderness and camping for 2 weeks. All right, and we also next have Stacy.
Well, hello, everyone. Thank you for having me. I'm a psychiatrist at the Student Health Center. I also practice in the community. It's really wonderful to see so many of you join in, and that know that you're interested in the helping professions. There's really such a tremendous need in our field, and particularly now with the pandemic, the need is that much greater overall. So thank you for taking time out of your afternoons to come to join in, and hopefully you'll have some of your questions answered this afternoon. I completed my undergrad degree at the University of Florida. I was a microbiology major there. Hopefully this is no longer a myth that you have to be a science major to go to medical school, because that is not true. Everyone has to do the pre-med required courses, and that's the one thing that's common and required for everyone. There was a diverse of majors in my medical school class, and that made everyone that much more interested, and we learned from each other. And actually some of those who were science majors like myself was like, I should have been, but ultimately everyone had to do the core classes. And then in about my junior year, you take the medical college admission exam. And back then when I took it, it was offered once per year. Thank goodness now it's multiple times per year, so that's good. And then you go on interviews, and different reasons decide where and what med school works out, et cetera, the interviews. I don't know, I got caught by the gators probably. I stayed at UF for a long time. I did med school there. It's 4 years. The first 2 years was all coursework, anatomy labs, et cetera, in your anatomy. 2 years of core, then the clinical rotations the last 2 years, which is when it really feels like, well, med school as you think it's going to be, you get exposure to the rotations, and you kind of really realize, or you figure out what you enjoy or what you're not. Because a lot of times you go in thinking one thing, and then once you do the rotations, you say, well, maybe not so much, or you say this is the one. So ultimately, when I started residency, I also stayed at UF for residency. My first year, I did a first year of internal medicine, which I'm so thankful for. And then I transitioned to psychiatry after my intern year. As one of the things as you all know, with internal medicine, a lot of what you see most times, patients with any kind of mental health struggles or challenges present with primary care. And I was seeing those patients, and really I became very pulled towards working with those patients. And so we had a psychiatry residency program there. I started working in volunteered and all that, and I transitioned into the program. So psychiatry residency is 4 years. And so because I'd done 1 year of my internal medicine year, I finished up with the other 3 years in psychiatry, and I never looked back. It really was a good fit, a good mix of both science and actually allowed me to use some of my strengths. And, you know, like any other focus, it's challenging, but it's also very rewarding. And I get to work with an exceptional team of everyone, the panels and in CAPS, and it helps with, you know, the collaborative effort between student health and CAPS has been exceptional. And so I think definitely helping professionals, the teamwork and the collaboration goes a long way. And so it's been very helpful. And one thing too, I think with this panel today, it's nice to have everyone represented and present. Thank you.
Yes, thank you so much. So now, everybody who is attending, you can feel free to put questions in the chat. Ella is going to read those questions out. I have a couple as well, but would really help us to gear our questions is, in addition to putting in the chat any questions, if everybody can put in the chat right now what type of helping profession they're thinking of. Maybe you can put in your major or what career path you're considering, what master's or doctorate program you're considering. That will definitely help us to choose the questions a little bit better. All right, so we're seeing forensic psychology or clinical psychology, private counselor. You know, a couple others will come in. But my first question, I guess, will be that students we meet with often feel that they have to choose one right major in order to continue on to their master's or PhD, and in order to move into the helping professions. Stacy kind of already alluded to this. You know, you don't have to be a science major to get into medical school, but what would you all how would you respond to students who think there's only one major that they must go into in order to pursue a career in the helping professions? And I would say for now, we don't necessarily have to go in a certain order. If you feel compelled to answer a certain question, just feel free to unmute yourself. There will be plenty of questions.
I can speak to, I believe, Kyra. She wants like to get a degree in forensic psychology or clinical psychology. And the good news is that she needs to apply to a PsyD or PhD in clinical psychology. And while she's doing this, within the coursework, there is a perspective within the program. So you become a doctor of clinical psychology, and you have a specialty in forensic psychology. So you get both degrees in a way, both specialties. So you don't need to choose. It's like, just look at the program if they have this perspective.
And to speak to the question about majors, my major was English literature and Spanish, double major. So nothing to do, well, I mean, they're both having to do with trying to understand human beings, but yeah, I had to go back and take some courses before I got my master's. So it wasn't until I had that job in the wilderness that I knew I wanted to go into mental health. So I wasn't really thinking in those terms in undergrad. And that was okay. It probably took a little bit longer, but it was okay. It was fine. And you don't have to, I think in a lot of ways, you know, storytelling, narrative therapy is a big part of what I do. And I work with people that speak Spanish. So I think you can use the skills that you have from whatever major you have, and it can apply to whatever profession in mental health.
I was going to add to that as well. I'm first generation, and one of the things that came up with my family is like, what's your major? What are you going to do with the major? That pressure of like having a direct route that they acknowledged was high on me. And I found just even the opportunity to explore and go into the Career Resource Center and asking questions and reaching out to people in the field provided me more awareness of what I could do next and made me feel like less of a box of my next steps in the journey, because there's so much variety in ways we ended up in this profession, listening to the colleagues and all our different backstories. And my undergraduate isn't in social work. It was completely, I was doing pre-speech pathology. So I just wanted to add that.
All right. I see one of the questions that came through, and it's a question that I get a lot of times as a career counselor as well, is what is the difference between psychology and psychiatry? Because they oftentimes, I think, get used interchangeably, but obviously there are some major differences there. So whoever would like to jump in and kind of highlight anything there would be super helpful, I think.
So for me, oh, sorry, Maria. For me, the easiest way to explain it is that psychiatrists can prescribe medication in addition to all the additional training of medical school that we don't get in psychology. Psychologists cannot prescribe medication. That's like if you were to say, should I go to a psychiatrist or should I go to a psychologist? Well, psychiatrists, they do also some counseling many times, right? Dr. Brown, that you can also do some counseling. And the main difference is the medication management, and because they do go to medical school and we don't go to medical school.
Yeah, in some states right now, we have the privilege to prescribe medications as psychologists in different states. However, to get this privilege, you need about 3 more years on top of what you are like studying to get this privilege. So the psychiatry, they're going to medical school, and psychology, we are going to professional schools of psychology or universities. So yeah, the privilege of prescribing medication, you won't have it with a psychology degree.
Right. And so in terms of, so medication management, so evaluate and treat patients, and medication management is predominantly what I do, and then refer for therapy. There are some psychiatrists who do therapy, and therapy is taught in medical school to a different degree now than it was 10 or 20 years ago, predominantly because as more medications become available in different treatment modes, and all the emphasis is more on the different treatment modes in terms of medication or different modes of treatment, and so then we have the experts, the psychologists, the therapists, they'll specialize in their areas of treatment. So that's the main difference there.
And just to add on to the second part of the question, LCSW versus Lmhc, I can speak for LCSW. LCSW, they're both based in mental health. However, LCSW has the component of social justice as well as community resources. I know something emphasized in my program was person and environment. So there is case management. Both can essentially open up their own private practices and focus on mental health. However, with LCSW, you don't have to go through the mental health route. There are some LCSWs who are not doing therapy. They're doing case management services. They're head of senior living facilities, administration. There's a broader range of things that you can focus on. I chose to make my focus on mental health. However, you can go through a master's in social work program and say you want to focus on child welfare and just do your practicums in child welfare, do your practicums in elderly care in a hospital doing case management, but not necessarily that being your focus.
Awesome. Thank you, Renee. You beat me to it. I was about to just ask you to tack on. That was perfect. And I know just to kind of add on to this question as we're creating kind of the contrast between different professions and what they do, Greg, you alluded to kind of the difference between clinical and counseling psychology and kind of coming back to that. So if you can, since we're on this kind of trend, maybe talk a little bit about both of those areas.
Yeah, definitely. And I can speak more to counseling psychology because that's where I was just getting out of. And so I can't speak, maybe Maria can speak a little bit more to clinical, but what my understanding of it is generally we do the same things. You can be a professor if you want, you can go into research if you want, you can be a therapist at a counseling center like myself, you can go to private practice. So the functioning, there's really not any differences there. I think it's more historical and it's more a little bit on the values of what is focused on. Generally, historically, counseling psychology has been focused on, positive psychology, strength-based psychology, career psychology, talking about all the factors that go into career and your choices and what shapes you to develop your career. That was a big part of counseling psychology. It's always been a very strong emphasis on multiculturalism and social justice. So that's always been a big part of it. But I think nowadays, a lot of the programs are sort of mixing and combining either way. So you want to just look at each program and figure out which one is the best fit for you, get to know them. Like, do you lean towards counseling psychology? Like, do you lean towards clinical psychology? Sometimes it's a place to start, but then you'll want to take the next level and get to know the people that do the interviews, and you're getting interviewed, but you're also interviewing them. You want to keep that in mind because you have some power in those interviews, and so you want to be asking the question, like, is this a really good fit for me, as you get to know those training programs.
All right, thank you so much. We have so many questions in the chat going on that we're just gonna keep firing them off at you all. So one question that we had was what academic requirements are needed, such as can you go directly to a doctoral program from a bachelor's, or do you kind of go in sequential order with a master's and then a doctoral program?
So yes, you can go straight to a doctoral program, and you can get your master while being in the doctorate program. It will save you some time for practicum, so it's a smart thing if you really want to invest like in your next 4 or 5 years of doing this. So yeah, definitely you can go straight to it. And I want to tell everybody that we are going nowhere. We are here. So even if you have additional questions, I'm open for Dawn and Ella just to share my email so I can help you and navigate so you can succeed and follow your dreams in helping others. But yes, going straight to a doctoral program and you get your master while doing this as well. So,
and another requirement that you might need to look into is completing the GRE. So I remember for in the mental health counseling, we didn't need to do the GRE, but for the psychology program, we needed to have the GRE completed. So that's one of the reasons why I decided to join the mental health counseling program, because for me to go into the PsyD, I needed to wait 1 more year to prepare myself for the GRE, and then I would rather just start from undergraduate. But that's one way in which you need to prepare yourself too. There was a question about what to do in terms of preparation. Study for the GRE, it might be required.
Yes, and this question was asked in a couple of different ways for a couple of people, but here's one that's more specific. What can I do now as a second semester sophomore going into my junior year to prepare myself for further schooling like doctorate or master's program? Um, so another way a couple of people have been asking are like, what are some extracurriculars, any research assistance positions? What can students be doing now to get into these programs?
I mean, something I would recommend, because I was very into extracurricular activities a little bit too much during undergraduate, was to find something that you're passionate about, like avenues that you're engaged in. For instance, I volunteered with migrant workers, fighting for rights for migrant workers in the community. They like to see diversity, and they like to see that you're pursuing something that matters, and it shows out in the resume and when you even talk about it. So if I had to invest time outside of academics, I would definitely find something that you are passionate about or even interested in pursuing for your master's. Say I see someone mention like working with children, you can volunteer for Children's Home Society, because that would be exposure to kids that have been traumatized, and little interventions there, and you'd have the opportunity to see therapists and therapeutic foster parents, just certain things like that, but it's based on your interest.
That's volunteering based on your interests early on is a good thing to do for any field you go into. You know, GPA is something, of course I mentioned GPA and everyone, you know, don't be. That's a lot of times what I know when I was in college, I mean, so this is the hyper focus on. But with GPAs all constant, what else do you bring to the table when you're applying to any grad program or any higher level of education? It's what is it that makes you stand out? And so finding your passion in any other way, like volunteering, and also sticking with it. You know, I did volunteer with the hospital when I was in Gainesville while I was an undergrad there, and stuck with it in and out, and it really you really get a lot of exposure, and it does help show more than just, you know, your academic pursuits and all that. So it's it does really help no matter what field you end up going into. So it's a good thing for the resume.
I remember following up with a volunteering. I remember volunteering in a hospital, just taking games to the kids and playing with them in the rooms, and that was really nice and prepared me a little bit, not necessarily in terms of clinical work, but just like to, you know, to get to know a little bit more how to interact, how to engage the kids. When later on I was doing an internship working with kids in play therapy. So that was a nice experience for me. I recommend it to other people who would enjoy it.
And just to kind of piggyback off of that, but I guess this is more so for doctorate programs, how important is doing research at the university, or is it more so engaging with people in this more volunteer focused way?
I think so my doctorate is a PhD, which is different than a little bit different than a PsyD. And I think there's a bit of an emphasis on the research part. So I think that, so my program was, Maria and I were talking about this yesterday, like what's the percentage? Like, is it 50-50, 60-40? So maybe 60-40 emphasis on research in my program. So it's pretty important in a program such as mine. It also, but they're interested also in what are you interested in researching? So are you interested, like, so I did a lot of research on the LGBTQ community. some of the issues, psychosocial issues that they were going through and experience on a day-to-day basis. There were other people that did lots of research on like needs assessment of refugees. So my program had a big social justice, multicultural focus. And so if that's the kind of program that you're looking for, then doing research in those fields would be important. Mm-hmm.
Awesome, thank you. And a question that comes up, we're seeing a couple of different variations of this as well from students, and I get this question oftentimes from students as well, is really as an undergraduate student, right? So studying psychology, oftentimes there is that difficulty in finding maybe an internship opportunity or what sort of entry-level roles they can get into just with a bachelor's degree. So do you have any advice for our students that are maybe just obtaining their bachelor's or looking maybe at internships, but they're at that undergrad level where they're not in a grad program yet? What may be some avenues for them to explore or some options for them to look into if they're trying to get experience at that kind of very entry-level point?
Well, I know that one of the barriers to getting an internship is usually the confidentiality piece, right? So when we're asking to observe somebody doing therapy, in reality, it's really hard to have somebody there observing because we have the confidentiality of the patient, of the client. So that's one of the barriers to being able to find a place that allows you to sit in. I'm not sure what other people's experiences have been with that, but I know that I had a really hard time finding, any type of observing any kind of internships before going into school. So as soon as you go into school, there comes the year when they give you practicum experiences, and then, you have a list of places that you can apply and things like that. But before getting the degree, and even with a bachelor's degree, it's really hard to find anything like that other than getting like a job as a youth counselor, or perhaps even in a hospital. And I can't remember the position of the people working in hospital. Maybe Dr. Brown. When they work in the inpatient and they have like I don't think that they need a specific degree, but they do get experience a lot with mental health concerns.
Like the intake, the assessment.
Yeah, I think that intake and behavioral something, right?
Yeah, behavioral tech.
Oh, yes.
Behavioral health tech.
Behavioral techs. Behavioral techs. So I don't think that you need a specific degree to get that, that job, but you can get a lot of exposure in that job.
Awesome. So just to kind of summarize for those listening, so really finding those options of, depending on the population you want to work with. So a youth counselor working with kids in some capacity, volunteering for nonprofit organizations, ones that you're passionate about. So using those avenues, I think right now is kind of what I'm hearing kind of collectively is the best route when you're at that undergrad level, still kind of seeking the option. And then the practicum experience or the kind of hands-on experience will come with the grad program or medical school residency. All of that will start to come in. Awesome. All right. And I know we have a lot of really specific questions. So I will say at the end of the session today, because we're running into obviously the last couple of minutes of this hour, we could probably keep talking for 5 hours with the amount of questions, but students who do have questions for any of our panelists who are willing to share their information at the end, we'll post that and we'll send that out in an email afterwards. So that way you can get in touch with the individuals that are here today to ask additional follow-up, because I know some are really, really particular. And so we want to try to keep them general to kind of make sure that we're answering as much as possible. So if you don't get your exact answer, don't worry. There will be a way for you to connect afterwards, and we'll make sure to provide that information. Yeah, Dawn, I don't know if we had another one that you had on deck.
Yes, so kind of to Ella's point of going a little bit more general and then getting those specific questions asked later on. We know that everybody wants to get into this helping professions because we care so much about helping others and making sure that we all are healthy. But what is a challenging aspect of your role and how do you cope with that within your role?
I would say for me, as just being in this field for numerous years, I've worked in different settings and we hear a lot of stuff. And something I was talking to one of the interns that I supervise, and I would say something I would have emphasized is self-care is not optional, it's mandatory. And I think being in the helping profession, I know my program talked about it, but it wasn't until you're actually knee deep in it, I realized it is not optional, it's mandatory. And for me, it's definitely taking the time out to check on myself throughout this process and even make sure I have a plan for what I need and not lose track, because there's always something that we always feel like we could be doing, because there is something that we could be doing at all times. But having that reframe and engaging in self-care for me has been beneficial.
One challenge for me has been work-life balance. If you do decide to go into a field that's going to be demanding, the grad school is going to be demanding of your time and your energy. And you do have a family and you have people that you're close to that expect things from you. You want to be open about that and have conversations with them, preferably beforehand. Like, this is going to be hard. This is going to be tough. And I'm not always going to be there in the way that maybe you need. But then making that time. So, and then trying to carve that time out, because it is going to be needed to be carved out. But then also having the conversation about, like, this is tough. And I might not, there were a lot of late nights and stuff that I wasn't there for my family. And so for them to expect that, it didn't solve it all, but it helped.
And I'll say that, I mean, you know, just your interest in the helping professions, it says a lot. And it's challenging, but it's rewarding. And it's the reward that keeps us going from day to day. The journey to getting there, as the panelists have shared today, it's a marathon. And you needed support along the way. And it's important to be aware of your support sources, and also to identify, to reach out when you need help. And it's good you have the Career Resource Center and to ask for guidance and direction. And I'm sure this is one form of that. I think in general, when you're thinking about just helping professions in general, is those, some of the challenges with those who, or patients in general, in terms of reaching out for help. And we know in general, there's still some stigma with reaching out for help when it comes to mental health. And so that's still, that's still some of the challenges we deal with in terms of at work, and part of it that makes it challenging, and where we need the support of each other in our careers. And but at the end of the day, when you've been able to help a patient and achieve you see them doing better, it's very rewarding, and that's what keeps you going on.
I think that the other piece is being flexible and knowing that you can also change routes, at some point. I know that at the beginning, I did a lot of work with sex offenders, and I started to affect me, and then I switch to another population, right? So we can always do that kind of stuff where we can, start with one population, and then we find it that it might be too hard for us to deal with it, and then we can, find another job and with another population that might be a little bit better or more fitting for us. So just being flexible and knowing that whatever you get at the beginning doesn't necessarily have to be, for the rest of your life, right?
Mhm.
Great, thank you. And I think this may be our last question unless we have time for another. But as professionals, how do you prevent a client's personal situation from emotionally affecting you? I know this can be a very hard one.
I can speak up for this question, and it's so relevant, but at the same time, you have like this extensive training over like 5-7 years, and you're always working with under supervision, and this is why you are having this supervision. So there you can share, and it's okay when you suffer with your clients, and the thing is to trust your gut intuition. And when you are choosing practicum sites, internship sites, or places to work with, just trust your intuition. Who is the other person? Can I work with this person? Because having a bad supervisor, it's very common, and it's like extremely health damaging, like mental health, physical health. So but if you have a wonderful supervisor, you have like this parent who is helping you, just to, like a little child, making one step and another step, and all of a sudden you are running. And what Stacy said, just the reward that you are receiving, oh, wow, this person is improving, and just saying thank you, or like, I feel relieved. It's like enormous gift that we are receiving daily. So yeah.
All right, thank you. And then our last question for today is just, what is one piece of advice that you would give to the undergraduate students here today as they're looking to pursue a career path in the helping professions?
I think that the main one is seeking counseling ourselves. So seeking therapy, we talked a little bit about observing therapy sessions, and the best way to observe it is by going yourself to one and seeing how it goes. But also it will help you to sort things out that are related to the career and not related to the career. But it can definitely be very, very impacting for counselors throughout the whole, as many years of experience as you might have. Right?
As for me, one piece of advice I would give would be being flexible in terms of not feeling like you have to have the exact answer, and you can apply to multiple graduate programs at the same time. Because I was the undergrad student, like I feel like I have to only apply to social work programs or only apply to mental health. If I wasn't exactly sure, I would kind of get paralyzed in that decision. I'm like, and then someone's like, you could just apply to both. So being flexible with opportunities and not boxing yourself in.
My
And
advice,
go ahead.
oh, okay. My advice would be to stay, to find a cohort and be there for each other. There's so many times where I felt like I'm not going to get through this. this is so impossible. This is a huge mountain to climb, and I can't even see the light at the end of the tunnel. And then they were like, yeah, I know. And just like them saying that, I was like, oh, okay, I'm not the only one. Like that was enough to help me keep going. And so like just knowing that it's hard, and there's other people around you that are doing the same thing, that's been a huge help. So no one can expect to do any of this on your own. There's just no way. So use your cohort and your supervision.
I will add to Greg's comment, and my advice is just reach out to people who have done it. Like reach out. Those people love helping others and will support you. Just like with any questions, don't hesitate, don't be strangers. And I'll also share my email. So whoever is interested in studying clinical psychology, reach out. I'll be happy to help you, give you all the tips and advices that were given to me, and seek a lot of support. Trust your gut about the programs, like Winnie said, and like the people, and like Stacy said, like, oh, you are thinking, I want to be in a clinical psychology or like working with kids, and all of a sudden, it's not for me, maybe something else, whatever. So yeah, but reach out. People have done it, so you can do it too.
Absolutely. And I may be repeating myself, but it's a marathon. It's not a sprint, and you don't have to have it all figured out today. It's one day at a time. Utilize your support sources, your resources, ask questions, gain exposure how you need to. Okay. And it's challenging. Any career in life, it has its challenges, but when you're passionate about it, you keep at it, it will pay off. It's also rewarding.
Awesome. Thank you so much to all of our panelists. I know I learned new things today. I'm sure many of our staff and students that were in attendance also learned quite a bit as well. And we know that this conversation can continue, correct? We know that there's so much more information than what was shared today, and so many more questions that can be answered. So as mentioned, everyone that attended the event today, we will be sure to send a follow-up email, the same type of email you got to confirm and click the link to join today. You'll get another one of those after the event with contact information so that you can follow up with these amazing panelists. And so we want to thank you for your time. We want to thank all of you who took time out of your afternoon to attend. And if you want to see more events like this, I'm going to put my email in the chat. I would love to hear from you because we are planning more workshops and more events throughout the year. So we want to make sure that we're tailoring it to what you, the students, want. So I will go ahead and put my email in the chat so you can email me and let me know if you liked it today. And with that, we will officially sign off. And we want to say a huge thank you again to our panelists. So a round of applause. Thank you so much for taking the time out of your day to be with us. I know we all appreciate it. So thank you again.
Thank you.
Thank you.
The little one.
Okay, thanks.
So I'm going to go ahead and stop the recording.